Hello, and welcome to my presentation. My name is Max, and my chosen drug is oxycodone. A bit of background. Oxycodone is a strong and potent pain relief medication that is a semi-synthetic opioid, meaning it is both a derivative of the natural poppy plant and synthesized in a lab. It belongs to a group of medicines called opioid, narcotic, analgesics. Oxycodone changes the way the brain and nervous system respond to pain, helping to reduce discomfort and make pain manageable. Oxycodone is available in several forms, including liquid solution, standard tablets, extended release tablets, standard capsules, and extended release capsules. Doctors choose the type of oxycodone based on the kind and severity of pain. Immediate release options are often used for sudden, severe pain, while extended release versions provide longer lasting pain relief. It is typically taken orally and should always be taken exactly as prescribed, as using more than advised or for longer than needed can increase the risk of side effects or dependence. While effective for severe pain, it's generally only used when other treatments have not worked. What is oxycodone used to treat? Oxycodone has proven overall effective in treatment for severe pain, both acute and chronic, though this is a less suitable option for chronic pain conditions due to the potential for abuse. Specifically, oxycodone is used when deemed suitable to do so by a medical professional and when alternate pain management systems have proven inadequate. In clinical practice, oxycodone is often administered to address moderate to severe acute pain, such as pain that arises following surgical procedures or from injuries. It may also be carefully used in monitored treatment plans for chronic pain, such as those associated with cancer or other serious illnesses, where ongoing pain relief is necessary to support quality of life. Pain is a highly likely outcome following surgery. Oxycodone has proven effective in the treatment of acute post-operative pain. In a 2017 study examining post-operative acute dental pain, oral oxycodone was shown to offer safe and effective post-operative pain relief and was a well-accepted alternative to other opioid analgesics. For chronic pain, a 2017 study found that cancer patients who were given oxycodone and other opioids for cancer-related pains had symptoms reduced to mild or no pain within 14 days. Pharmacokinetics. Absorption. Oxycodone is absorbed into the bloodstream fairly well when taken by the mouth, with an oral bioavailability of about 60 to 70%. Immediate release forms start working within 10 to 30 minutes, while controlled release forms take about 1 hour. Distribution. After absorption, oxycodone binds to proteins in the blood, mainly albumin, about 38 to 45%. The liver metabolizes oxycodone primarily through enzymes CYP3A4-5 and CYP2D6, converting it into inactive normoxicodone and active oxymorphone metabolites. Metabolism. The drug and its metabolites are mainly eliminated through the kidneys in urine, with approximately 72% of the dose excreted this way. Excretion. The elimination half-life of oxycodone ranges from about 3 to 5 hours depending on the form. Pharmacodynamics. Mechanism of action. Oxycodone provides pain relief by binding to opioid receptors in the nervous system, especially in the brain and spinal cord's dorsal horn. Although it has only moderate ability to dissolve in fat, evidence shows it can cross the blood-brain barrier without relying on active transporters like P-glycoprotein. This was illustrated in a 2018 study analyzing oxycodone's ability to cross the blood-brain barrier in rats. Once oxycodone enters the brain, it works by acting primarily as an agonist at mu-opioid receptors, where it has a very high binding affinity, and to a lesser extent at kappa and delta type opioid receptors. Activation of these receptors reduces the transmission of pain signals in the nervous system, resulting in analgesia. What are the adverse effects or contraindications? Side effects include constipation as the most common, nausea, vomiting, dizziness, drowsiness, headaches, sweating, and dry mouth. Serious risks include confusion, very low blood pressure, seizures, and dangerous breathing difficulties, especially at higher doses. Adverse drug interactions. Any drug that slows down oxycodone breakdown, like some antibiotics, antifungals, and HIV medication, can cause the drug to build up, raising overdose risk. Any drug that speeds up the breakdown of oxycodone, like seizure medications or antibiotics, can make oxycodone less effective and cause withdrawal symptoms. Alcohol, sleeping pills, anxiety medications like benzodiazepine and other sedatives can dangerously increase drowsiness and shut down breathing, sometimes leading to death. Drugs that affect serotonin, such as some antidepressants or migraine medications, can very rarely cause a serious reaction called serotonin syndrome, with fever, confusion, and muscle stiffness as symptoms. Other opioids that act differently, like buprenorphine, can block oxycodone's effects or even trigger withdrawals. Contraindications. People with serious breathing problems, like asthma, should not take oxycodone, along with people with known allergens to oxycodone, pregnant women, and patients with a high potential for abuse. Thank you for listening.